All right, guys, back to school time. Unfortunately, though, 14,000 children suffer backpack injuries every single year. And with classes beginning in just a few weeks, a lot of people are buying those backpacks right now. So what should we look for? What should we know? Joining us right now is Dr. Shah Dodwad from UT Health and Memorial Hermann with some tips that we need to know. Thank you, doctor, for joining us.
My pleasure. Thank you for having me.
All right. Backpack issues. Let's talk about the biggest issue is probably the weight, right? The weights for a small child, even a teenager.
Yeah, weight is definitely a big part of it. You know, obviously the bigger and the heavier the backpack, the more chance for having some sort of injury. Ideally, you want to keep the weight less than 10%, which is kind of a lot of people, you know, that's a big surprise. If you think about somebody who's 100 pounds, that's a 10-pound or less backpack, right? And
that's like two books.
Yeah, it's like nothing, right?
Yeah.
So, but if you are going to be putting more weight than that, you know, a lot of times we transition to roller backpacks and things like that students can use. Or just carrying your you know, having a backpack and then having a few books in your hand as well.
Okay, to balance it out. Also, what about the straps? Because a lot of the kids want to just throw one over one side. That's the side that they carry it on.
Right, I used to be one of those kids,
yes.
But now I know better.
Yes.
I know better now. So you have two straps and you want to make sure that you're evenly distributing that weight. You want a nice, thick, broad strap with good padding. And you want to, and you know, we used to carry our backpacks pretty low.
Right.
And
pull them up.
Yes, pull them up. You want the bottom of this backpack to be above the waist.
Okay. All right, pick those books up. Now, if parents are concerned, are there some symptoms that they could look out for? Are there some things that say, you know, their kids are doing this, or maybe they're doing it when they leave and then they go to school and they put the one strap on. So they come home and they're in pain, or they're saying, Mom, you know, Dad, what can parents look out for?
So, these kids are going to be complaining about back pain, and you know, a little bit of back pain here or there that you give them some Tylenol or Advil and it goes away. That's okay.
Okay.
But if they're constantly complaining of pain, if it's pain that's waking them up at nighttime, if they're complaining of numbness, tingling, or weakness in their legs, those are all red flags that they need to be seen and evaluated by a medical professional.
All right, perfect. Doctor, thank you so much for joining us.
Yeah, my pleasure. Thank you for having me.
All right, you can find all this info and a replay of this segment online at clicktohouston.com. After the show, we'll post it under our video tab on our homepage. Remember, when you're shopping for a backpack, the wide straps.
Yeah, and make sure it's not too big for your kid.
For the child too, even the size of the backpack.
The size, right. You don't want them tipping over, so keep them well balanced.
Oh, no more books. All right, thank you, doctor.
All right.
Although that would be funny if these kids started tipping over one by one.
We do.
I'm just kidding. All right, thanks, guys. Thank you, doctor. And here's a live